I'm Dr. Heidi Jannenga. I'm a physical therapist who has practiced for a little over 15 years in sports medicine and outpatient private practice. Now, I'm also the co-founder and president and chief clinical officer of WebPT, which is a software platform and EHR specifically designed for rehab therapists, which includes PTs, occupational therapists, and speech-language pathologists. We launched the company in 2008, and we now serve over 85,000 users across the nation, which equates to about 15,000 practices, equaling 40% market share. But today, I'm here to talk to you about an issue that's plaguing Americans, an issue that's making a significant impact on their overall health, their families, their communities, their pocketbooks, and their overall experience in healthcare. It's the opioid crisis. The stakes are only escalating, and we as physical therapists have a big part to play in the overall solution. Now, 126 million Americans is the approximate number that are impacted by musculoskeletal conditions today. That's nearly 1 in every 2 active adults. $213 billion is the amount in dollars that these conditions cost us with every year of treatment, care, and lost wages. And these numbers are only going to continue to escalate as the increase in numbers of the population of age over 65 adults continues to increase within the next 2 decades. Now, even more concerning is the treatment of musculoskeletal conditions, specifically spine-related disorders, has become one of the most expensive conditions of healthcare costs and the primary reason for opioid prescriptions. In fact, a study at Boston University, jointly sponsored by United Healthcare and the American Physical Therapy Association, revealed that many patients suffering from something as common as low back pain are being prescribed dangerous pain medications at a significantly alarming rate. And yet, multiple studies have shown that low back pain patients who access therapies such as physical therapy first are 75 to 90% less likely to have short or long-term exposure to opioids. That's 75 to 90% less chance. That Boston University study also found that claims for musculoskeletal episodes accounted for more than 16% of United Healthcare's overall total spending, a percentage greater than associated with any other condition. And 75% of that expenditure was spent on prescription medications. To put that into a little bit of a perspective, a little over 11% of United Healthcare spending went towards the treatment of cancer. In other words, United Healthcare has been spending more money on prescription medications to treat low back pain than they have been on treating cancer. Something is seriously wrong with that picture. And it points to a very clear directive. We must make it easier and more affordable for patients to access less invasive treatments to help them heal over the long term, rather than merely masking the pain in the short term. Now, how do we change this paradigm? Clinical guidelines consistently emphasize the importance of conservative, non-prescription, and non-invasive care first. They also talk about it for the second pathway of treatment approach. But still, clinical practice is not well aligned with these guidelines today. For example, let's take arthroscopic partial meniscectomies, which are still one of the most common surgical procedures for the treatment of knee pain. In 2013, there were approximately 700,000 arthroscopic partial meniscectomies completed, with an annual direct cost of over $4 billion. Yet, in study after study of randomized trial testing, in which patients with a meniscal tear or osteoarthritis of the knee, when they were given both a partial meniscectomy alongside of physical therapy, it showed no significant difference in the outcome for that patient if they would have just had physical therapy alone. It went on to say that this procedure should only be used as a last resort when extensive exercise programs or physical therapy had been exhausted. And we're seeing that same trend now with opioid prescriptions. There is absolutely no question that opioids have become a very pervasive and persistent problem. They're being used as a first resort, despite the fact that data point after data point consistently directs us to non-invasive treatments such as physical therapy and recommended it as a first choice rather than staving off the addiction potential. Now, as I mentioned earlier, when patients with low back pain seek physical therapy or other conservative treatments such as chiropractic care or even massage therapy as a first line of intervention, the chance of short or long-term exposure to opioids drops up to 90%. Researchers at Stanford University School of Medicine, as well as the Duke School of Medicine, have found patients who underwent physical therapy not only for low back pain, but for neck pain, shoulder pain, knee pain, also saw significant drops in the overall use of opioids and exposure to opioids in the short and long term. From the care quality, public policy, and healthcare affordability perspectives, we have an opportunity, as well as, in my opinion, an obligation, to transform our treatment of musculoskeletal conditions moving forward. Now today, despite the fact that the percentage of American adults who are developing musculoskeletal injuries, 90% of them who experience a neuromuscular condition and can benefit from the likes of conservative treatments of physical therapy never receive it. Instead, they're getting turned to these opioid medications, steroid injections, or surgery. And some people are simply just living with the pain. So why? Why would they do this? Well, there are many reasons, many barriers to entry, chief among them being the financial hurdles of copays and coinsurances that exist. There's also the problem of physical therapists not being viewed as primary care providers when it comes to these neuromuscular skeletal conditions. Plus, the lack of direct access. That is, direct access awareness by patients and other disciplines in which people don't have the understanding that you can actually walk into a physical therapist's office today and see a physical therapist without requiring a physician referral. Now, fortunately, all of those factors we can make a difference on. We can actually change. Now, despite direct access being a focal point of advocacy within the PT community for many, many years, rehab therapy professionals often fail to leverage their direct access privileges to the full extent of the law. We actually recently did a study, the WebPT 2019 State of Rehab Therapy Report showed that nearly 80% of all the respondents indicated that their organization requires a physician referral for their patients as a condition to treatment, even today in 2019. Despite the fact that every state in our country allows for a minimum of an initial examination by a physical therapist, and every insurance company also pays for that service. In addition, to many patients and providers not knowing how to access physical therapy, we're also trying to overcome a perception problem. Though we are doctorate-level professionals who are highly trained in diagnosing and treating neuromuscular conditions, many patients, as well as providers in other disciplines and payers, still aren't clear who we are, what we do, the value that we can provide, and the role that we can play with these types of patients. Physical therapists are the neuromuscular experts when it comes to healthcare providers and should be utilized as such in pathways for patients entering into the healthcare system with any type of neuromuscular injury or pain. Today, we are at a confluence in which historical change is happening at a record pace, and physical therapists have an opportunity to make a huge difference. But we need to act now, because now is when everyone in healthcare and beyond is looking for a solution to this opioid crisis. And we, as physical therapists, can be a big part of that solution. The bottom line is that the barriers that are preventing patients from seeking PT must be broken down. This will require a collective effort among all of us, providers, insurers, payers, and of course us as physical therapists. As it stands today, physical therapy can actually cost more upfront for patients who have high deductibles and high copays for specialty providers. This causes that initial barrier to entry into the system. Now, these are barriers that we're actually trying to fix and we're working on. But I know that there is light at the end of the tunnel. In fact, certain payers are beginning to break down some of those barriers. We are currently working with United Healthcare, for example, who recently announced that it will waive the copay for a patient's first 3 visits when diagnosed with a low back pain condition. Now, this may not be the perfect solution, but it's definitely a start. And it really shows what can happen when all stakeholders are willing to come together to talk about finding a better way. Now, of course, the onus at the end of the day still is on us as physical therapists to advocate, and that's what I'm doing here today. But we need that help from all of you, from all of the healthcare professionals to improve the data that can help influence the healthcare benefit design and demonstrate the value that providers, payers, and patients can accomplish when working together. The other issue that we're up against when it comes to behavioral health psychology is changing the paradigm of patients understanding that they need to prioritize for the long term and not just the short-term fix. Now, we all know that the brain is not necessarily wired for this, and the brain is really wired for that short-term fix, and today, that short-term fix is in the shape of a pill and or surgery. And we need to really change that paradigm. It will, again, take all stakeholders in the community to work together to better educate patients about their long-term health and the true consequences that can come with the quick fix. We've all got to become more proactive and hopefully thinking about patient care not only for a fix to the problem, but also proactively in prevention of care. And the sooner, the better. The harmful repercussions related to the opioid epidemic are impacting lives in so many levels. I'm sure many of you may have family members or friends who have been affected by this. We have a once-in-an-era opportunity to undo the damage that has been inflicted and to ensure that moving forward, people who are dealing with pain have everything they need to make educated choices about their health care, choices that are supportive to their overall well-being as individuals and not just dollar signs or numbers. We must come together now to transform the healthcare system to work better for patients with neuromusculoskeletal issues. Together, we can reduce healthcare costs, improve the opioid epidemic, and deliver better, long-lasting results to patients. And isn't that what we all got into this profession to do? Thank you.